Très
Has
bien.
anyone else come to hate us?
On est prêt à commencer. We are ready to start. À vous, Monsieur Leblanc.
Alors, bonjour tout le monde.
Hello, everyone.
Good afternoon. Today, I am joined by my colleagues, Minister Hajdu and Minister Blair, and by Dr. Tam and Dr. Njoo. Last night, the Prime Minister held the 25th call with Canada's First Ministers to discuss their shared response to COVID-19. The Prime Minister reiterated to his colleagues our government's commitment to supporting provinces and territories, and also to supporting Canadians during the difficult pandemic. Les premiers ministres ont également
The premiers also discussed the importance of avoiding all non-essential travel, both within the country and abroad, and increasing the control measures at the border for anyone coming back into the country.
Clearly not the time to travel. Stay close to home. We know the pandemic is not easy. It's been extraordinarily difficult. But together, as Canadians, we will come through this. I would now like to ask my colleague, Bill Blair, the Minister of Public Safety and Emergency Preparedness, to say a few words. Bill?
Well, thank you very much, Minister LeBlanc. First of all, I'd like to begin by thanking everyone for joining us today. Fighting the ongoing pandemic remains the Government of Canada's top priority, and we will continue to take strong action to limit the spread of COVID-19 in our country. That includes providing support to the provinces and territories. And from the very beginning, we have been very clear. From the very beginning, we have been in regular contact with our provincial and territorial partners to assess the needs of the hardest hit regions and to provide support that will help protect the health and safety of Canadians going forward. And today, we are building on that support with an important announcement. As the Prime Minister said a short time ago, the Government of Canada will deploy 2 federal mobile health units to the Greater Toronto Area. And this is in response to a request that we have received for assistance from the province of Ontario. These units will be staffed by the province and have facility for up to 100 beds in each of them. They will provide additional hospital beds and facilitate the transfer of non-critical care patients out of critical care to ensure that these specialized resources are available for those who will need it the most. And this will help relieve pressure on Ontario's strained hospital capacity due to the prevalence of COVID-19 in the province of Ontario. We will continue to work with our provincial and territorial partners to assess the need for similar units elsewhere in the country. The Government of Canada has also been providing support to the provinces and territories through federal surge capacity support. That includes laboratory and testing assistance and equipment, and help with contact tracing and funding for voluntary self-isolation sites. In response to requests for federal assistance, we've also provided support to improve the situation in long-term care facilities in both Ontario and Quebec. In Quebec, as you'll recall, members of the Canadian Armed Forces provided assistance last year in 47 long-term care facilities, primarily in the hardest hit regions of Montreal, Laval, and Montérégie. The Government of Canada also provided funding to support the transition from the Canadian Armed Forces to the Canadian Red Cross. And Red Cross teams continue to provide assistance in long-term care facilities in Quebec and will do so at least until March 31st and as long as they are required. The Ontario government, in Ontario, the Government of Canada has deployed 275 members of the Canadian Armed Forces last spring to provide support in 7 long-term care homes in that province. And that deployment ended at the end of June when the province indicated that their situation had stabilized. In response to subsequent requests for federal assistance, we have provided funding to support the Canadian Red Cross operations in 27 long-term care homes across Ontario, and they will remain in place until March 31st or as long as they are required. The Government of Canada has also approved a request from Manitoba last November for federal assistance for long-term care facilities. And in response to that request, we worked with the Red Cross to support its COVID-19 response efforts in LTCs in Manitoba. I would also note that members of the Canadian Armed Forces were deployed in December to the Shamattawa and Red Sucker Lake First Nations in Manitoba and arrived this week in Garden Hill First Nation to help fight the spread of COVID-19 in those communities. We know that the need for relief and assistance continues to be of great need and concern across the country, and we are standing by to provide additional support to our partners, including the provinces and territories, as required. Let me also take this opportunity, if I may, to reiterate that Canada has implemented some of the strongest border measures in the world. Temporary restrictions remain on optional and discretionary travel right across all of our borders. We will continue to strongly advise Canadians against travel abroad unless it's absolutely necessary, and to be very clear, it is not the time to travel now. Those who do travel must now go through the extra step of getting pre-departure tests before they can return back home. And it's important to note that this does not replace the required quarantine period. Quarantine has been and continues to be our most effective measure, and it remains mandatory. We have scaled up the presence of the border services and public health officers at our border to ensure that people understand their quarantine obligations, to verify their quarantine plans. And we are working with the provinces and territories to ensure that there is follow-up and enforcement of those quarantine requirements. The vast majority of Canadians have been very responsible in adhering to the quarantine requirements, but unfortunately, some do not follow the rules, and there needs to be follow-up, enforcement, and consequences for those who choose to put others at risk. No matter where you're coming from or how you enter Canada, and unless explicitly exempt, you are required to quarantine for 14 days upon your arrival, and compliance is essential. If you break the rules of quarantine, the penalties could be severe, up to 6 months in jail or up to $750,000 in fines. But perhaps more importantly, the consequences of putting your family, your friends, and your community at risk are things that I think all responsible Canadians should take very seriously. As all COVID-19 decisions, including those related to the border, continue to be made with the health, safety, and security of Canadians as our most important and overriding priority. And as always, we'll continue to work with all of our partners, the provinces and territories, and use science and evidence to inform all further steps to keep Canadians safe. Thank you very much, and I'll return to you, Dominic.
So thank you very much, Bill. And now we're going to ask Dr. Tam and Dr. Njoo to say a few words, and finally we'll conclude with our colleague, Minister Hajdu. So over to you, Dr. Tam.
And bonjour à toutes et à tous.
Hello, everyone.
Over 731,000 cases of COVID-19 in Canada, including 18,622 deaths and over 67,000 active cases across the country. Nationally, an average of 6,080 new cases have been reported daily over the past week. There continue to be high numbers of people experiencing severe illness. There are an average of over 4,650 individuals with COVID-19 being treated in Canadian hospitals, 870 of whom are in critical care, and on average, 149 deaths are being reported each day. Canada continues to monitor for virus variants of concern. To date, the National Microbiology Laboratory reports 31 cases of the B.1.1.7 variant that was first identified in the United Kingdom, and 3 cases of the B.1.351 variant that was first identified in South Africa. From now on, we're going to be referring to the scientific nomenclature of these variants. As the rollout of COVID-19 vaccines proceeds across Canada, federal, provincial, and territorial authorities are working closely together to monitor vaccine safety. As of January the 15th, there have been 90 reports of adverse events following immunization. These include any health problems that occurs following immunization, but is not necessarily caused by the vaccine. 27 of these reports, that is 1 in 22,000 doses distributed, were considered serious, such as a severe allergic reaction, or serious events undergo a detailed investigation. To date, no unexpected vaccine safety issues have been identified. Although national daily case counts have been trending down in the past 10 days, daily case counts are still elevated, and regional fluctuations in disease and outbreak activity continue. This gives us hope that community-based control measures are starting to take effect, but it is still too soon to be sure that these measures are strong enough and broad enough to set us on a steady downward trend. Likewise, as severe outcomes will continue to lag behind increased disease activity, we can expect to see ongoing heavy impacts on our healthcare system and health workforce for weeks to come. Recalling our track down the curve of the first wave, we talked about the need for caution to avoid pitfalls that would stall or reverse our progress. This time, the way down is even more complicated, with much higher daily case counts, more affected areas across the country, the emergence of new virus variants of concern, and stretched and exhausted healthcare capacity. On this even trickier path, we know that the same certainty as the last time, that if we ease up too soon or too quickly, resurgence will be swift and strong. Every day, we are one step closer and better times are ahead, but there is no fast track. We must stick with public health measures and individual practices that we know are effective for controlling spread. Unless and until infections rates are low enough to allow public health authorities to test, trace, and isolate effectively, easing of restrictions risks even stronger resurgence. This is why we must all continue to do our part to slow the spread, and that means postponing vacation travel to a better time in the future, avoiding, shortening, or limiting outings and activities to just the essentials, and maintaining hand washing, masking, and spacing to limit opportunities for the virus to spread. This is the tough part of the COVID-19 marathon, but together it will be easier. Thank you.
Bonjour à toutes et à tous.
Hello, everyone. There have been over 731,000 cases of COVID-19 in Canada, including 18,622 deaths and over 67,000 active cases across the country. Nationally, an average of 6,080 new cases have been reported daily over the past week. There continue to be high numbers of people experiencing severe illness. There are an average of over 4,650 individuals with COVID-19 being treated in Canadian hospitals. Unfortunately, the interpreter can no longer hear Dr. Njoo. Service will be interrupted until the sound returns. Thank you.
À ce jour, le Laboratoire national de microbiologie signale 31 cas de variants détectés initialement au Royaume-Uni, le variant B117, et 3 cas de variants détectés pour la première fois en Afrique du Sud, le variant B1.
Service will resume. From now on, when speaking of these variants, we will speak of scientific nomenclature. As the rollout of COVID-19 vaccines proceeds across Canada, federal, provincial, and territorial authorities are working together to monitor vaccine safety. As of January 15th, there have been 90 reports of adverse events following immunization. These include any health problems that occur following immunization, but are not necessarily caused by the vaccine. 27 of these reports, about 1 in 22,000 doses distributed, were considered serious, such as a severe allergic reaction. All serious events undergo a detailed investigation. To date, no unexpected vaccine safety issues have been identified. Although national daily case counts have been trending down over the past 10 days, daily case counts are still elevated, and regional fluctuations in disease and outbreak activity continue. This gives us hope that community-based control measures are starting to take effect, but it is still too soon to be sure that these measures are strong enough and broad enough to set us on a steady downward trend. Likewise, as severe outcomes will continue to lag behind increased disease activity, we can expect to see ongoing heavy impacts on our healthcare system and health workforce. for weeks to come. Recalling our trek down the curve of the first wave, we talked about the need for caution to avoid pitfalls that could stall or reverse our progress. This time, the way down is even more complicated. With much higher daily case counts, more affected areas across the country, the emergence of new virus variants of concern, and stretched and exhausted healthcare capacity. On this even trickier path, we know with the same certainty as last time that if we ease up too soon or too quickly, resurgence will be swift and strong. Every day we are one step closer and better times are ahead. But there is no fast track. We must stick with public health measures and individual practices that we know are effective for controlling spread. Unless and until infection rates are low enough to allow public health authorities to test, trace, and isolate effectively, easing of restrictions risks even a stronger resurgence. This is why we must all continue to do our part to slow the spread. That means postponing vacation travel to a better time in the future, avoiding, shortening, or limiting outings and activities to just the essentials, and maintaining hand washing, masking, and spacing to limit opportunities for the virus to spread. This is the tough part of the COVID-19 marathon. Together, it will be easier. Thank you very much, Dr. Njoo.
Well, thank you very much, Dominic and colleagues. Good afternoon. Every time that you decided to stay home this week, you helped protect our healthcare workers in hospitals. And over this past week, over 50,000 people have canceled their flights and postponed travel. Thank you so much for protecting each other. Less travel means less risk for everyone. Aux Québécois et aux Québécoises, merci de
To Quebecers, thank you for sticking to curfew. You are helping protect healthcare workers and others.
And to continue to follow public health advice. While our government is working to get you vaccines as soon as possible, you can continue to make a difference. You can continue to save lives. And you make a difference by wearing a mask when you need to go out and by getting tested when you have symptoms. Remember, if you have any symptoms, even if mild, stay home, isolate, contact your local public health unit to ask about testing. And download the COVID app if you still haven't. Please keep sharing credible resources to help your close ones have access to the right information on COVID-19 and vaccines. We update Health Canada's website regularly with new information, and just this morning we added a new chart on the number of vaccines administered across the country. Now, as Canadians, we know that winter is difficult, but good things are happening because Canadians really are helping each other. More people are receiving their COVID vaccine. But as Dr. Tam and Dr. Njoo have pointed out, we still have to keep pulling together. Now's not the time to let down our guard. Keep reaching out to vulnerable people in your communities and think about the resources that you can use or tell your friends and family about to take care of your mental health, like wellnesstogether.ca. And mark your calendar to join the conversation on mental health next week for Bell's Let's Talk Day on January 28th. Thank you very much.
Merci beaucoup, Patty. Alors, ça nous fera plaisir.
Thank you, Patty. Obviously, we'll be delighted to take your questions.
Bonjour, merci à tous. Nous allons donc procéder à la période de questions.
We're beginning the question period. We will be taking questions over the phone today. Every journalist has the right to ask one question and one follow-up question.
On the phone, each reporter can have one question and a follow-up question. To the ministers and the doctors, a reminder to put yourself on mute when you're not answering a question. Opérateur, première question.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez s'il vous plaît appuyer sur étoile 1 maintenant pour poser une question. And our first question, la première question est de Rachel Haynes from CTV. Please go ahead, la parole est à vous.
Hi, ministers and doctors. My first question is for Minister Blair about travel requirements and international travel. Are you considering stricter enforcement measures and quarantine measures when people return from international travel? As Dr. Tam mentioned, there are now 31 cases of the UK variant here in Canada, and today, even out of the UK, Boris Johnson is saying that this variant is more fatal. So does that cause some concern and make you think that you need to have increased measures when people arrive?
Yeah, Rachel, thank you very much for the question. It's an important one. And yes, we are concerned with the variants, and it's one of the reasons we've taken already some fairly significant steps in requiring all international travelers to submit to a pre-departure test within 72 hours of their departure to Canada. That measure has now was put in place in direct response to the concerns about the variant. But we are also examining all measures, and I will tell you simply, nothing is off the table. We're looking at taking whatever steps are necessary to protect Canadians. And we're looking at a range of options to strongly disincentivize. We have issued a number of significant advisories urging Canadians not to travel for discretionary purposes. But unfortunately, we have seen, and I think Canadians are quite understandably concerned, that some people are choosing to go on their spring break trip or to continue to travel to other areas that potentially put them and then upon their return other Canadians at risk. And so we are looking at a number of measures that can include further restrictions on international travel, additional tracing measures, additional quarantine measures, and enforcement measures in order to disincentivize and discourage people from making unnecessary trips. We'll do what is necessary to protect Canadians. And I also want to reiterate, we've been listening very carefully and working very hard with our provincial and territorial partners. We understand their concern, and it's a concern we all share. And so we'll work together to address these concerns, and we'll continue to add layers of protection in response to any emerging threat that we may face in regards to this. And we'll continue to reinforce the already very strong measures that we have put in place. The last thing I would mention is we have seen a significant indication from our American allies and partners that they are undertaking a number of measures. And I also want to indicate that we are in discussions with them and will continue to work with them to create symmetry in the way in which we respond. A loophole, frankly, does exist because the Americans previously had not placed any restriction on international flights coming into the U.S. And so that concerns us because that restriction is at our land borders, but not in air travel. And so we'll be working with the Americans on developing new reciprocal measures that can further protect Canadians as well.
Do you have a follow-up? Yes, thank you. And just as a follow-up to that, I mean, you're talking about measures that are going to be coming into place soon, but in the meantime, there have been over 100 flights that have come into Canada with passengers that have had confirmed cases of COVID-19. Just in the last week, Health Canada has posted on their website that there are 3 flights that have come in from Haiti where all rows have been exposed to COVID-19. So in the meantime, how soon can people expect to have these new measures in place? And, how concerning is that to Canadians when they see that there are still these a large number of flights that are coming in and posing a risk?
Again, thank you, Rachel, for the follow-up question. And let me reiterate that over 2 weeks ago, we imposed measures that required that all incoming passengers from any international destination, including from Haiti, be subject to a pre-test, a negative test within 72 hours of departure. There were some challenges in certain countries, including Haiti, with obtaining those tests in that jurisdiction. And so a number of measures were put in place. All of the people that came from those destinations, including Haiti, where the tests were not available, were immediately, upon their arrival, referred into secondary and referred to the public health officials. They were not allowed to move into the Canadian community and until steps had been taken to ensure that they did not pose a risk. And that's why we were able to detect through how we dealt with those individuals who were arriving very responsibly, in my opinion, to identify those who could be infected that had not yet previously had the test. We have now implemented new measures because a testing regime has been established that will allow us to test those people prior to departure. But we did take action to protect Canadians and Canadians' health against those arrivals that had not yet been able to take the test. But I also want to reiterate, we are continuing to look at all available measures. We will do what is necessary to protect Canadians. I would remind you that we have among the strongest protections at our borders of any country in the world, but we're continuing to examine all of the ways in which we can further strengthen that protection, because we share the Canadians' concern about the introduction of these variants. I think we've taken very, very strong action. We'll continue to look at ways in which we can improve our response.
Merci, thank you. Prochaine question, next question.
The next question, la prochaine question est de l'inaudible de la presse canadienne. Please go ahead. La parole est à vous.
Question from La Presse Canadienne. The question is for you, Mr. LeBlanc. You said that speaking to premiers yesterday, you said you spoke to premiers yesterday. You surely heard Mr. Legault ask for stronger measures with regard to travel. What is stopping you from going further? Can I understand from what Minister Blair said that you are attempting to negotiate other measures with the Americans, specifically regarding flights coming from the U.S.? Answer. I'll just specify, yesterday I did not take part in the first ministers' meetings. I was speaking to journalists about something else, another matter. However, I was briefed on this meeting, and indeed, the premiers talked about international borders. Mr. Legault repeated what he's already said publicly. He'd like stronger measures, more testing upon arrival in the airports. And as Mr. Blair has just said, we are currently examining other options, supplemental measures that we could put in place for international flights. We'll be giving details in the coming days, undoubtedly. The Cabinet is currently discussing various options, but as Minister Blair said, President Biden's commitment to working with Canada and Mexico on the question of borders is giving us another opportunity to discuss with our American counterpart how to best strengthen the border and strengthen border entry points, land entry points. We are examining then the possibility of other measures, but we already have very strong measures in place. We are open to implementing other measures. Further question. We are having trouble understanding what Minister Hajdu said. Are you talking about 50,000 annually cancellations? Since when? Are you talking about internal flights? Who are these 50,000 travelers who canceled their plans? Perhaps you could repeat my question for Minister Hajdu. Thank you very much. I believe 50,000 international trips were canceled, but if you repeat your question, Patty or Bill Blair will answer. Thank you very much.
Minister Hajdu, you just talked about 50,000 reservations that were canceled. So I was wondering if you could tell us from what date are we talking about? Are we talking when the PCR tests were imposed, or after that? Do you have a date for the 15,000 cancellation? And are those only international flights, or are those also in Canada flights?
Well, thank you for the question. And we can get you more specifics on the dates and when exactly the cancellations happened. But the good news is that Canadians have seen that the government of Canada is asking them to stop international travel. And in fact, 50,000 cancellations of bookings over the last last week demonstrates that people are understanding that this is a delicate situation that Canada finds itself in at the moment, and that people are pulling together and listening to the Government of Canada say, please rethink your travel plans. If it's not absolutely essential, consider postponing or canceling. And so we will make sure that our officials get you the details about when those cancellations began. But yes, the introduction of PCR testing, as well as our reminders on a regular basis about just how critical it is right now that we all pull together and stay home, is certainly resonating with Canadians. And I want to thank the Canadians who have canceled those plans, who have listened to the concerns, not just of the government, but of fellow Canadians who are saying, please, for the sake of our healthcare system, for the sake of our seniors and long-term care homes and other settings where people are really struggling, stay home. Thank you very much on behalf of the Canadians.
Merci, thank you. Prochaine question.
The next question, la prochaine question est de Ryan Tumulty from the National Post. Please go ahead. Your line is open.
Yeah, this question I think is probably for Dr. Tam. I'm wondering about what resources are in place to be able to screen for international variants. You know, how quickly you're able to detect them, and whether you're confident, I guess, in the number that you're talking about today really captures the full picture of those variants in Canada.
Yes, thank you for the question. So as you've noticed that as soon as we alerted to these variants, Canada was able to detect both the B.1.1.7 and the B.1.351 variant very quickly after we were notified. And so, you know, we did a number of different approaches to look at sequencing. One is that there was already investment into genomics through the COVID response, which is called a CanCoGen initiative, which meant that we could go very quickly into the database to look for these mutations. And this is about 5% of the positive cases that were screened. And different provinces, I think, have different capacities. So we are trying to enhance those. But we have asked provinces who can't do their own sequencing, of course, to send it to the National Microbiology Lab as well. And some of the approaches that we are taking, I guess, is several pronged. One is a more sort of surveillance approach where we will be looking for you know, ongoing sampling of the cases, but also some very targeted approach as well, such as if there was an outbreak that was unusual, if the cases were related to travel, if cases occurred after immunization, or if they occurred in immunocompromised individuals or someone who has a reinfection. So under those circumstances, we try to get those samples. Getting more samples from travelers. Alberta, for example, has been conducting a pilot, and all of those samples are being looked at as well. So the border testing pilot. So I think the bottom line is that I think compared to other countries, we have been sampling at a relatively good rate, but I think we need to do more. So right now, efforts are being stepped up to do that in a more significant way. And one of the key aspects is to join up the data related to the sequence with the epidemiology and other clinical information as well.
Yeah, and just as a follow-up, you talked a little bit about the potential for travel restrictions. I'm wondering why the delay? Why wait on something like this when we're seeing international variants? When, you know, what's the downside risk in your mind to putting in these new restrictions?
Yeah, Ryan, let me try to answer that. First of all, we're not delaying. And I'll remind you, when the first variant in the UK emerged, we were among the first countries in the world to suspend all flights from the UK. We also have taken other action as variants emerged in other jurisdictions. We were also among the first countries in the world to make a requirement for pre-arrival testing, 72 hours before people even got on the plane. We have been responding very quickly, and we've tried to be very upfront with Canadians to discourage them from taking non-essential discretionary travel, vacations, out of the country at this time. It's not the right time. We're also alerting Canadians that if they have left the country, and they may find it increasingly challenging to return because of the measures that we are putting in place, I think it's important that we respond in an appropriate, measured way, and in order to ensure the safety of Canadians. But we have not been in any way delaying our response. We continue to add additional layers of protection that have been proven necessary, based again on the best advice that we are receiving from the Public Health Agency of Canada. We'll continue to do so, and we're working with our provincial and territorial partners to ensure that the measures that we have put in place, the most effective of which, as I've already said, is quarantine, is truly effective. And in order to do that, we're working with the provinces and territories to improve both compliance and enforcement. We'll continue to look at all available measures, and I think a significant opportunity now arises with a new modified posture in the United States with respect to their borders that will give us an opportunity, and our officials and others are already reaching out and beginning important discussions, because that is the most common area of travel for Canadians, both out of the country and returning to Canada. And so it's important that we maintain some symmetry in a reciprocal arrangement with our closest ally, partner, and neighbor. And so we're working on all of those things, but we are moving forward, I think, very responsibly and prepared to do what is necessary to keep Canadians safe.
Merci. Thank you. Next question.
The next question, la prochaine question est de Elizabeth McSheffrey from Global News Halifax. Please go ahead. Parlez à vous.
Hi there. My question is for Minister Blair. Minister, I just want to touch on the decision to suspend the sale of decommissioned Rcmp vehicles. It's been more than 9 months since the Nova Scotia shooting, in which the gunman made use of a very convincing replica Rcmp cruiser. Why did it take the federal government until now to take this step?
Yeah, thank you very much for the question. First of all, let me be really clear. Impersonating a police officer is and remains a very serious criminal offense. And we've seen a number of incidents where individuals have attempted to use not just vehicles, but other police equipment, uniforms, etc., in order to commit that crime. And it is very serious. It is also an area of examination in the public inquiry that we have established in Nova Scotia to look at the tragedy that took place in April. Police services right across the country, not just the RCMP, but police services, municipal and provincial police services as well, also often dispose of their vehicles. This is an emerging issue that people, most recently in Antigonish, have chosen to purchase and modify those vehicles to make them appear to be police vehicles. It is a serious concern to us. I have directed the RCMP to suspend the sale of all of their surplus vehicles until this matter can be resolved, and we're working with but the provinces and territories on other responses to protect Canadians from this new emerging trend where individuals are purchasing these vehicles, modifying them to make them look like police vehicles. Now, we heard very clearly the concern that was being raised in Nova Scotia, and we've taken the appropriate steps to reassure Canadians that we have suspended the sale of those vehicles until additional, more effective steps can be taken. It's also a reality that these vehicles that are being used in this way are they're not uniquely available to police services, but also available through other means. And so we want to make sure that we put in effective measures to prevent individuals from buying these vehicles either as surplus from police services or from any other source and modifying them to be used in this illegal and inappropriate way.
And just by way of follow-up, I recognize the government will work toward more stringent measures, but it is still easy to buy LED lights, sirens, push bars, decals, all kinds of, police identifiers. It's still easy to buy those things online and to buy decommissioned vehicles from private sellers online. So I wonder, how confident you are that this move goes far enough to keep Canadians safe in the interim before you're able to develop those more stringent measures that you've spoken about.
Yeah, we've already taken a number of steps to prevent people from acquiring the decaling that's often used on our federal police vehicles. But as I've already indicated, there are police services across the country that vulnerability does exist. The availability of some of this equipment, most provinces, I will tell you, have regulations that prevent individuals from equipping any vehicle with red lights, for example. Flashing red light, which are restricted under their laws, their Highway Traffic Act laws, only for emergency vehicles. So some of those regulations are in place, and it's already, as I've said, a serious criminal offense to do that for the purposes of impersonating a police officer. And so that we have a number of legislative and regulatory tools available to us, but we are working with the provinces and territories to see if we can strengthen that regime in order to deal with these individuals who have, we now have two very serious incidents where individuals have modified the vehicles for that purpose, and we'll take the steps necessary to ensure it doesn't happen. And in the interim, I have directed the Rcmp to cease the sale of all of their surplus vehicles, but the vulnerability still remains for vehicles from other sources, and so there's still work to do, and we're doing that work.
Merci, thank you. Opérateur, prochaine question, next question.
Thank you. The next question, la prochaine question est de Boris Proulx du Devoir. Please go ahead.
Boris Proulx from the Devoir. Please go ahead. Question. Yes, my question is for Minister LeBlanc regarding non-essential travel. The government of Quebec has in some ways threatened to use a plan B, that is to set up its own minimum quarantine requirement in a hotel. Do you think this is a good idea? And do you have any plan to implement this idea across Canada? Answer. We are constantly talking to healthcare officials and people working in public security, as well as the provinces, to determine how we can ensure that measures are taken for anyone arriving in an international flight. We know what Mr. Legault has said. We've spoken as well to Sonia Lebel, another Quebec minister, and Cabinet is currently examining a series of options that would allow us to strengthen quarantine measures and testing measures for travelers who are coming home to Canada. We'll be examining this in the next few days, but obviously we are working with the government of Quebec, and the federal government can at any time, as the Prime Minister has several times stated, can at any time increase or tighten the measures. That's exactly what we're planning to do in the coming days, and we should have more news for you then. Together, we can make sure that our international borders are more secure. Question. I'd like nonetheless to know more. Is it workable if only one province puts that type of measure into place, whereas in the other provinces, the same measures that are currently in place are not strengthened? Answer. If we have the same measures in place at the 4 airports that are allowed to receive international airports, Montreal, Calgary, Vancouver, and Toronto, well, I spoke to Premier Ford several times this week and on the weekend. He would like to see testing for anyone who arrives at the airport. We know what Mr. Legault said as well. We agree fully that strengthening the borders, the measures taken at the border is a possibility. We will be making decisions based on sound scientific evidence.
Merci. Thank you. Prochaine question. Next question.
The next question, la prochaine question est de Mia Rapson from the Canadian Press. Please go ahead. Your line is open.
Hi, this is a question for Dr. Tam. There have been a couple of new treatments for COVID-19 that have either been approved or even promoted by Health Canada recently. One of them, a blood thinner treatment. I believe that I'm just curious if Health Canada has any guidance on the use of blood thinners, as well as another drug that was approved and started shipping out in December. I'm just wondering if you can talk about these new treatments and how you think they can help the pandemic and how they should be used.
Yes, I think it's really great that there's more and more evidence on treatments. Health Canada, of course, is the regulatory authority that approves treatments. But we are, I think, really relying on our clinical experts who are on the ground treating patients. So the clinicians who are treating patients have to decide what's best for them. So I think, and they will sort of look at the individuals in question to, figure out what is really in their best interest. I think the ones that I'm familiar with that have been utilized very widely to this point are things like dexamethasone that is used for hospitalized patients, which is an anti-inflammatory. I do know that some of the effects of COVID-19 involves an impact on your blood vessels or inflammation, and so I think it would depend on the clinical guidance at this point.
Okay, thanks. And for Minister Blair, you've talked a lot about, you said you're not delaying these decisions about the border, and you're talking about the testing that is required and the flight ban. But with all due respect, we know people got around the flight ban simply by flying through the United States from the United Kingdom and came in. And we've been told for months that testing is just a moment in time. So having a test 3 days before you get on a plane doesn't mean that 10 minutes after you got the test, you didn't suddenly contract COVID-19. So I'm just curious. And we also know now that these variants are not just circulating from travelers, but they're circulating in the community. So I'm curious how you expect Canadians to believe that we're really protecting us against these variants when the measures that are being put in place clearly have not worked.
Yeah, thank you very much for the question. And first of all, let me reassure you and Canadians that for those individuals, when we put the flight restrictions in prohibiting flights from the United Kingdom in response to the variants that emerged there, we also took steps to ensure that those people who chose to fly from the United Kingdom into the United States and then transit through the U.S. to Canada were also identified through screening by our border service agents. They were referred into Secretary and they were referred to PHAC for further follow-up and quarantine measures because we recognize that loophole. And I've already spoken about the efforts and the discussion that's taking place with our American colleagues to address that potential vulnerability that exists because the measures that they've put in place do not align clearly with our own. I think what I want to make perhaps most clear is that we are quite open to adding additional layers of protection and imposing additional measures. Nothing is off the table, as I've said, and we are considering a very wide range of additional options that can be imposed. But I think it's equally important that we fully utilize the value of the most important tools that we've already put in place. And I'll go back to what I believe is perhaps the best protection is the quarantine order that the Public Health Agency of Canada issues for all arriving travelers. And compliance with that order is critical to keeping Canadians safe. The police of jurisdiction, and I listened very carefully to Premier Legault yesterday when he spoke about how effective the police of jurisdiction in Quebec, the Sûreté and the municipal police services like the SPVM, were in enforcing the lockdown orders that the province imposed. And I would also highlight that we need more enforcement from the police of jurisdiction in areas where that's the Rcmp. The Rcmp have that responsibility. But in the vast majority of places, certainly in Ontario, Quebec, the police of jurisdiction are in fact the municipal or provincial police services in place. They have the tools available to them to enforce the compliance with the quarantine orders. And I think that enforcement is also going to be important. And so it's part of an ongoing discussion that we're having with our provincial and territorial partners to ensure that the tools that we have available to us that we know are effective to keep communities safe need to be fully utilized, because Canadians have to understand there are real consequences, not just to their health and to their families and their communities, if they break the terms and conditions and requirements of quarantine, but there can also be legal consequences as well. And I know the police have been somewhat reluctant to use the enforcement tools that are here, but it's necessary. And so we're having discussions with the RCMP, but also with other police jurisdictions through their provincial and territorial authorities to ensure that the tools that we have are fully utilized. And as I've indicated, we are also working with our international partners, with the provinces and territories, to add additional tools and requirements that we can put in place to provide that health assurance. You know, we've got a light at the end of the tunnel. The emergence of a vaccine and the exceptional work that is taking place to administer that right across the country it offers us, I think, a reason for real hope. But we have to ensure that we take the measures now to get through this period. And you know, we have all been trying to encourage Canadians to be responsible, to stop traveling for discretionary purposes, you know, to take the steps necessary for those who are returning Canadians and have a right of return, but we want to make sure that they do so safely. And so we will continue to put in, you know, layers of protection and control to ensure that the new variants are not brought into this country, and that we deal with them responsibly. And as I've also indicated, we know that the illness, as was said earlier, is already present in our communities. And so we have to make sure, working with our provinces and territories, that we take the steps necessary to protect Canadians, to ensure that our hospital capacity is not exceeded, that we do the work necessary to protect people in long-term care facilities or other vulnerable populations. We're working with our provincial and territorial partners to do all of those things, and we'll continue to work hard. We need Canadians to remain vigilant and careful as well, and that's what we're urging people to do.
Merci, thank you. We will take a final question. Nous allons prendre une dernière question. Opérateur.
The next question, la prochaine question est de Danielle Blanchette-Pelletier de Radio-Canada. Allez-y, la parole est à vous.
Danielle Blanchette-Pelletier, Radio-Canada. Go ahead. Question. My question is for Dr. Tam. I'd like to know what is the targeted vaccine coverage that we need for herd immunity? 70% or more? I'd like to hear what you have to say on the subject. Answer. I'll begin, but perhaps Dr. Njoo will be able to follow up. The target is not really known for the time being. Experts have noted that it may be between 60–75%. It depends. And it depends upon future knowledge that we have of the disease. We still don't know the effectiveness of the vaccines regarding virus transmission. Now, that's the first matter. We also need to keep in mind that if ever there are new strains of the virus that are much more contagious, then we'll need a higher level of vaccination coverage to attain herd immunity. Perhaps Dr. Njoo wants to add something. Thank you, Dr. Tam. I don't think I have anything much to add, but yes, indeed, the epidemiology is always fluid, as Dr. Tam has just said. We don't really know what the impact of new variants will be. The virus is continuing to evolve and mutate.
Quand on a commencé déjà avec la vaccination de la population, ça c'est un facteur.
We've begun vaccination.
Avec les programmes qui commencent maintenant à vacciner les Canadiens, mais l'efficacité du vaccin dans un essai clinique,
but we don't know but rather clinical effectiveness is not the same as real-world effectiveness. So we're not sure exactly what the vaccine effectiveness is. We'll continue to study the data, to analyze the data, not only here in Canada, but across the world, rather. Other countries are also collecting data. I think it would be very important to exchange this data and stay well informed to determine exactly what vaccination coverage is best to be able to attain herd immunity. Thank you. Follow-up question. I understand that all these factors may come into play. Do you think that no matter what the target is, that Canada will be able to truly attain it? I'm not just talking about the number of doses, but about the public's willingness to take a vaccine. Answer. This is Dr. Njoo. I'll start. I think this is a major issue. We need to increase public trust in vaccines. Most Canadians are very optimistic and encouraged by what we've begun in terms of vaccination. It's very important then to continue to be transparent when we communicate with Canadians. We talked about the side effects today, what may occur if you are vaccinated, even if these side effects are not directly caused by the vaccine. And it's very important to continue to be transparent with Canadians about vaccination. We need to speak not only about news that may be concerning, but we need to talk about our work with provinces and territories. With experience, as more and more Canadians are vaccinated, other Canadians will be encouraged to receive the vaccine as well. We need to offer the vaccine to all Canadians. This is what's recommended. And of course, we want the highest possible number of Canadians to be vaccinated by September.
Merci à tous.
Thank you.
Everyone. This puts an end to today's press conference. Ceci met fin à la conférence de presse d'aujourd'hui. Merci.